Good evening, everyone present here. I am Faraz from IGCP Group. Welcome all the participants on today's webinar that is on a very important topic that is the silent side effects sexual dysfunction across common female malignancies. And as we know that this is a very important topic, we need to be focused. And so we have very eminent guest, none other than Dr. C. Sharat Kumar sir. And let me share some of the achievement of sir. Sir has done MS, PhD, and sir is a director of Mediwave Clinic at Bangalore, and like he is expertise in IVF and fertility research hospital, and he also has lots of he has been working as a super specialist hospital. Without sir has done MBBS from sir. You can keep the slides, sir, back. Yeah. Sir has done MBBS from Bangalore Medical College, MS in Infertility in Bristol University of England, PhD from University of Mysore, Male Infertility, Fellowship in European Committee of Sexual Medicine, FPSM Fellowship in Psychosexual Medicine, JSS Medical College, and Sir has done DRCOG from Royal College of Obstetric and Gynecology, UK. And Sir has more qualification in his batches like DGLS, and Sir is
Can speak.
also sir, over to you, sir. You can proceed
Yeah,
from
yeah,
here. Stage
yeah,
is yours.
yeah. So, good evening, everybody. I sincerely thank you for joining today's webinar. I also thank today's coordinator for us and the IGCP team for giving me an opportunity to address you. Today's topic is female malignancies that cause sexual dysfunction. I'm going to cover this subject in the following chapters: introduction, cancer in male, female sex organs, that is vagina, breast, uterus, cervix, ovaries, and summary. So, all cancers, whichever the reason is, especially cancer of sexual organs, can impact both sexual functions in both the partners, that is, male as well as female. Today, we are talking about the malignancies which affect the female sexual partner, and we are focusing on the sexual organs which cause the sexual dysfunction. Irrespective of the cancer, it can affect the sexual dysfunction. But today we are particularly focusing on the sex organs because they are the ones which directly affect the sexuality of a person. Both men and women have accelerators that get sexually aroused. But cancer of any organ, especially of the sex organ, can break or interrupt those accelerators and keep the partners from feeling in the sexual activity. Breaks can be either mental or physical. Cancer and the cancer treatment and sex. The side effects of cancer as well as its treatment can impact the sexual dysfunction in both the partners. There will be loss of libido, desire, orgasm, intimacy. All these functions are affected. Anytime there is emotional or physical distress, the couple will put the sexual health on the back seat. Maintaining sexual health and intimacy while living with cancer can help a person feel less isolated, provide feel good endorphins, and it is a natural pain reliever also. Friends, here I would like to emphasize that sex is not just for pleasure, it is a treatment also. A person who has got cancer, if he indulges in sexual activity, that feel good endorphins are released, and that itself is a natural pain reliever also. The effect of cancer on sex in women. The woman feels no longer sexually desirable without hair or breast, which might have fallen, or she might have lost the breast, hairs are lost because of the radiation, chemotherapy, and the cancer itself. Cancer treatment lowers the estrogen level, resulting in sexual dysfunction. Cancer symptoms themselves can result in loss of self confidence and emotional outburst and feeling lonely, and that itself causes sexual dysfunction. So, what are the common cancers in women that affect the sex life? Cancer of the vagina, cancer of the breast, cancer of the cervix, ovarian cancer, uterus cancer, and endometrium cancer. All these five organs, female sexual organs, female reproductive organs, the cancer of any of these or combination of these will result in the loss of sexual activity in the woman. Let me start with the breast cancer. Breast cancer is the most common type of cancer in women and the leading cause of cancer related mortality in women. Survival rates have markedly improved in recent years, mainly due to the widespread implementation of screening mammography and therapeutic advancements. This improvement in survival rates has led to growing interest in identifying the factors that impact on the sexual life in these patients. Friends, earlier, any person diagnosed with the cancer of any organ, especially as the sex organs, they used to feel that yes, that is the end of the life. Now it is not like that. The treatments have made so much progress that the patients, the clients are living longer. And once they have longevity is increased, their needs also increase. And they once the cancer is treated, they want the sex. That's why treatment of the sexual dysfunction in cancer survivors is very, very important. What are the signs of breast cancer? The signs of breast cancer are a lump is felt in the breast, change in the shape of the breast, dimpling on the skin, milk rejection, fluid coming from the nipple, an abnormal fluid, a newly inverted nipple, or a red or scaly patch of skin. These are some of the signs of the primary cancer of the breast. The secondary cancer, that is signs in those with distant metastasis. Once the cancer lands in different organs, the organs, wherever they have gone, they will cause signs and symptoms that include bone pain, swollen lymph nodes, shortness of breath, or yellow skin, or whatever the organ where distant metastasis has occurred, that organ will have signs and symptoms. Unatypical changes that transpire in patients who have undergone surgery or radiation therapy, disrupt perception of the body image. It is the body image which is hurt, lost. Once the body image is lost, once the self-esteem is lost, once the self-confidence is lost, she loses the sexual interest, desire, libido, and she no longer enjoys the sex. As the most common malignancy affecting women, breast cancer can bring about multiple physical and psychological challenges. Among the greatest challenges are those associated with the sexual dysfunction. Chemotherapy, endocrine therapy, surgeries, radiation can all have a large effect in altering women's sexual health and function. Sexual dysfunction in breast cancer could be emotional distress, sadness, depression, issues related to body image, personal appearance, stigma attached to the cancer, and negative impacts on personal interpersonal relationship. The love and affection between the couple before the cancer was diagnosed was different, and the effect of cancer leads to so many emotional interrelationship problem. The husband may start avoiding the sex, thinking that the sex will cause increase in the cancer, or she may no longer be attractive. So both things are possible. Either it could be more care and avoid the sex, or no care and avoid the sex. Both will equally hurt the feelings in the lady and lands her up in the sexual dysfunctions. Coming to treatment of sexual dysfunction of a cancer of the breast survivors, especially if they are in the premenopausal women, there are two medicines available for this treatment: flubanserin and bremelanotide. These medicines were referred to as female Viagra. They are not connected with Viagra or sildenafil citrate. They do not belong to PDE5 inhibitors family. They are entirely different medicines. These medicines increase the sexual desire in premenopausal women. They do not enhance the sexual performance. They increase only the desire. The next cancer is the cancer of the vagina, that is vaginal cancer. It is a rare cancer. There are two types of cancers, primary vaginal cancer and secondary vaginal cancer. Primary vaginal cancer originates from the vaginal tissue. They are squamous cell carcinoma, adenocarcinoma, sarcoma, and melanoma. Secondary vaginal cancers involve the metastasis of cancer that originates in different parts of the body. It could be local spread from the cervix, endometrium, uterus, and the fallopian tubes, and the ovaries, and the pelvic organs. Or it could be a distant metastasis from some other cancer anywhere in the body. Cancer of the vagina, the signs of cancer of the vagina are abnormal vaginal bleeding, dysuria, dyspareunia, tenesmus, or pelvic pain. However, 20% of women are asymptomatic at the time of diagnosis. Vaginal cancer occurs more frequently in women over the age of 50. It can often be cured if found and treated in early stages. Surgery, radiation therapy, chemotherapy are used to treat the vaginal cancer. So, cervical cancer is next cancer is the cervix, cancer of the cervix. Cervical cancer is quite common. Cervical cancer can develop as a result of abnormal cells that begin to appear in the cervical tissue over the time. This is how the cervical cancer appears. Sexual dysfunction in cervical cancer includes loss of libido, diminished lubrication of the vagina, dyspareunia, dissatisfaction with the sexual life, relationship problem, narrowing or shortening or dryness of the vagina, avoiding sex, reduced frequency of intercourse can all occur, and orgasmic dysfunction. All this can occur in a lady who has got cervical cancer or a lady who has had the cervical cancer treated or undergoing treatment. These are the symptoms and sexual dysfunctions which occur in her. HPV and cancer. Human papillomavirus is a common sexually transmitted virus. For most women, immune system clears the infection. Most types of HPV do not lead to cancer. However, in few women, the infection lingers and creates malignant changes. So, what are the changes that occur in the vaginal and cervical cancer in the vagina? The main side effect of the treatment of vaginal and cervical cancer is vaginal dryness, pain, stenosis, narrowing. If the ovaries have been affected by surgery or radiation therapy, they will no longer produce estrogen. This will cause vagina to become very dry and it cannot expand easily during sexual intercourse. Radiation therapy to the pelvic area can also cause vaginal tissue to lose its elasticity and shrink and narrowing of the vaginacus. Friends, what exactly happens with the radiation therapy to the pelvic organs is the organs lose elasticity, especially the vagina, which is an elastic organ, which expands during sex, which expands during parturition, during delivery. It loses the elasticity and it becomes a rigid lead pipe like structure. So, vaginal insertion by penis or dildo or vibrator, it becomes very difficult because it can no longer stretch. And if it is forcibly stretched, it yields and tears. Cracks will appear on the walls of the vagina and in the introitus at the opening of the vagina, and that will cause severe pain. So, vaginal stenosis, vaginal narrowing causes dyspareunia. And shortening of the vagina, that is the length which is usually 3.5 inches to 4.5 inches length of the vagina, due to the surgery of the cervix or the vagina, or due to hysterectomy or due to oophorectomy, it causes shrinkage of the penis size both in length and diameter. That makes the penis inconvenient to have the intercourse because the male partner no longer enjoys the sex because it is short, And the lady also feels pain when deep insertion is done because it pulls and pushes the deeper structures of the pelvic, causing severe pain. So, what are the treatments available for vaginal and cervical cancer? If vaginal changes make sexual penetration difficult or painful, lubricants, especially water soluble lubricants, dilators, and vibrators, will be helpful. Regular pelvic examinations after treatment are required to prevent vaginal stenosis. During treatment, also, the vaginal rehabilitation is important. The lady has to be advised to use continuously the dildos, vibrators, dilators, and lubricants so that her vaginal canal doesn't shrink. That is vaginal rehabilitation. The next cancer is ovarian cancer. It originates from the ovary. It may originate from nearby structures such as fallopian tubes or peritoneum. Ovary is made up of three types of cells, cellular types: epithelial cells, germ cells, and stromal cells. When these cells become abnormal, they have ability to divide and form tumors. These skin cells can also invade or spread to the other parts of the body. So this is how the cervical cancer of the ovary appears. What are the symptoms of ovarian cancer? The first stage of the cancer of cervix, of the ovary, may not have any symptoms or may be vague symptoms. Symptoms become more noticeable as the cancer progresses. Symptoms include bloating, vaginal bleeding, abnormal bleeding, pelvic pain, abdominal swelling, constipation, sexual dysfunctions, and loss of appetite. Common areas to which ovarian cancer may spread include peritoneum, lymph nodes, lungs, and liver. What are the impact of ovarian cancer on the sexual dysfunction of the lady? Ovarian cancer, the disease as well as its treatment can significantly affect the sexual health and intimacy. Surgical impacts. Oophorectomy or hysterectomy can lead to hormonal changes, reduced libido, and vaginal dryness. Chemotherapy and radiation therapy can cause fatigue, pain, changes in the and results in sexual dysfunction. Psychological effects may include anxiety about the physical changes or fears about the intimacy. The very fact that the cancer has come to the lady itself will put her into mood of situation. She no longer thinks about the sex because she thinks that yes, this is the end of my life and I am no longer wanted by my partner. The next cancer is the uterine cancer. Uterine cancer includes two types of cancers: endometrial cancer, coming from the lining of the uterus. It accounts for 90% of all the uterine cancers. The symptoms include changes in the vaginal bleeding, abnormal bleeding, bleeding between the two cycles, menorrhagia, metrorrhagia, or pain in the pelvis. Then a second type of cancer is uterine sarcoma, originates from the muscles of the uterus. Symptoms include vaginal bleeding or a mass in the vagina. What are the side effects of the uterine cancer on sex? Cancer of the uterus can affect sexuality in both physical and emotional ways. Some treatments can cause dryness and narrowing of the vagina, which can make sexual penetration difficult or painful. The removal of the uterus, cervix, and ovaries can affect sexual pleasure and orgasm. So, treatment. What are the treatment options available for cancer survivor of the uterine cancer? Use of vaginal lubricants, gels, creams, estrogen creams to the vagina to lubricate it. Exercises help to strengthen the pelvic muscles, ease pain, help bladder and bowel function, especially Kegel exercise. Yoga, meditation can help to relieve the pelvic pain and ease the sexual function. Counseling or support groups can also be good resource of advice. Intercourse is not the only way to be intimate. Partners may find new ways to intimate that fit comfort levels and needs. So it need not be always sexual intercourse. It may be other types of foreplays that will help the couple to overcome the cancer side effects. So, friends, I am coming to the tail end of the program. Conclusion: cancer can significantly impact the sexual function in women. Cancer treatment can also result in sexual dysfunction. It is better to find ways to intimate and feel sexual life while living with cancer. It will help the patient stay connected with the partner and the family members. It is important to take steps to preserve the sexual function while treating the cancer, especially when cancer of the uterus or the fallopian tubes are involved. It is better to preserve the ovaries so that it continues to function and liberate the estrogen. And whenever any surgery of the pelvic organs are done, the nerves supplying to the vagina may be spared so that vaginal function remains. Early rehabilitation is important to get back to the sexual life. Vaginal rehabilitation is very, very important. Using of dilators, vibrators, vaginal gels, water soluble gels, and estrogen mixed gels, that is estrogen, they will keep the vagina alive, ready for the intercourse after the treatment is over. If rehabilitation is not started in the early days, complete stenosis of the vagina, atrophy of the vagina can occur. It may be very difficult to later on to start the sexual life if it is ignored in the initial stage. So, tips for navigating sex and cancer: taking a step back. If sex feels too challenging, go back to the basics. Start the foreplay. Start with hugging, kissing, cuddling before working up your way to the sex for more intimate touching. Looking beyond the intercourse, intercourse is not the only thing. There are more funs and games other than the sexual activity. They can be indulged. Expand list of sexual activity, include more foreplay and other pleasurable sex game that act and get the ball rolling again. So, friends, a cancer survivor, a female, should be looked after in such a way that she feels comfort with the sex and continues to enjoy the sex. Sex itself is a treatment for so many things, including the pain during the cancer, emotional outbursts, depression, sadness. All these can be treated very effectively if the sexuality is maintained. And all the surgeons, gynecologists, oncologists who are involved with the treating of the cancer of the female sex organs should think that she may require sex later on in her life, and sexual rehabilitation, especially vaginal rehabilitation, has to be started much early so that she doesn't totally land up in sexual dysfunction and becomes an useless sexual partner for the partner. So, thank you very much for your patience hearing. I conclude this lecture with a last remark that sex is an integral part of the wellness. It is an integral part of the general health, and a person who is sexually active will have lot of other endorphins released, so that well-being is achieved. And this well-being can be achieved only when proper precautions are to be taken during the treatment of the cancer of any woman with sexual organs. So thank you. Over to the moderator for us for today's deliberations. If there are any questions, I'll be very happy to answer.
Thank you so much, sir, for taking this topic very comprehensively. I hope, sir, this topic knowledge is going to help all the participants who have joined this session on their practice too. Sir, we have received some questions from the participants. With all your permission,
Yeah.
shall we take these
Can you type
questions?
it on the screen?
Uh, uh, yeah, sir. The first question is, sir, related to prevalence and mechanism. So, in your experience, how prevalent is sexual dysfunction among women with breast, cervical, and ovarian cancer, and what are the main pathophysiological mechanism behind it?
Yeah, it's a very good question. See, more than 90%, if I can be permitted to tell, all cancer survivors will have sexual dysfunction of all the sex organs, that is, breast, cervix, uterus, vagina, and all organs, and the endometrium also. So, any organ, once it is involved with the cancer, can result in sexual dysfunction. All these organs and all the treatment, that is chemotherapy, radiation therapy, surgeries, and the hormone therapy, all can result in the sexual dysfunction. Of course, not all will come and get the treatment. Most of the women who have sexual dysfunction after the cancer or the cancer survivors ignore it and lead the life as if it is like this only. Yes, it is the end of my life. It is the end of my sexual life. Hardly only about 10 to 20% of the women with sexual dysfunction come to the treatment. Here, since it is a male dominant society in India, a lady herself will not come to any sexologist or meet any gynecologist for the treatment of the sexual dysfunction. Unlike the men, 90% of the men who have sexual dysfunction comes for the treatment. Women hardly come, only 10 to 20% come because they don't know whom to approach for the treatment of sexual dysfunction. And majority don't know that sexual dysfunction treatments are available. This will lead to less number of women approaching for the treatment. So the answer to the first question is yes, more than
Yes.
90% have sexual dysfunction. Part two, hardly 10 to 20% seek medical help. Over to you.
Thank you so much, sir, for explaining it really well, sir. Moving forward, we have another question, sir. Like, how do different treatment modalities like surgery, chemotherapy, radiotherapy, hormonal therapy, and frequently affect sexual health outcomes in this malignancies, sir?
Yeah, that's another very nice question. See, what happens is all the women as well as men, they have one thing that drives the sex. We call them as accelerators. That is mood, libido, or desire. All the sexual activity starts from the stimulation from the external five indriyas, that is panchendriyas, that is the brain, eyes, ears, tongue, and the skin. These panchendriyas, they lose their activity once the cancer is diagnosed. The brain stops functioning towards the sex because that is kept into the last. Any problem anywhere in the body, the sex is kept in the last. It is affected. Libido, desire, orgasm, intimacy, all are affected once the diagnosis is done. And the couple will keep this sexual activity into the last. They will be more worried about the treatment, the cost involved in the treatment, and the pain during the treatment, especially the radiation therapy, and the pain during surgery and after the surgery, chemotherapy for falling of the hair and skin discoloration, which occurs due to chemotherapy, and hormone therapy, which reduces the estrogen and testosterone, will all make the lady less attractive. She loses her the self-esteem. Physically, she looks completely diseased, no longer attractive for the male partner. The male partner also feels that, oh, I should not have sex with the person who has got cancer. It may spread to him, or he may hurt her, or the cancer may aggravate during the sexual activity. So, all these things, both physical as well as emotional effects of cancer and the treatment, will impact the sexual dysfunction in both the partners, not only the female, also on the male partner, that ultimately makes them to stop sexual activity or have sexual activity very rarely. Next question.
Thank you so much, sir, for answering this question, sir. Again, in a very good way, sir. Like you have explained really well all the points, sir. One last question we will take, sir. It
Yeah.
is related to how important is multidisciplinary approach, oncologists, gynecologists, physiotherapists, psychologists in managing sexual dysfunction, and what model care you find most practical, sir.
Yeah, it's an excellent question. The person whoever is treating, primary person, the person who has picked up and taken up the responsibility, it may be a family physician or a gynecologist. Usually the first diagnosis would have been done by the family physician or the gynecologist, this cancer. So it is the primary responsibility of this person who picks up the disease, with whom the client has got lot of faith. This person should go on taking care with multidisciplinary approach. For example, initially he may refer the person to an oncologist, later on to an oncosurgeon, or a urologist, or a general surgeon. And after the treatment, one may require the treatment with a psychologist or a psychiatrist for counseling the couple, for making them to understand that the cancer is not the end of the life, sexual life is important. So there, the role of the psychiatrist and psychologist come to the picture, and the role of the social worker to give her the hope, the give her, to encourage her to involve with the sexual activity. There, the social worker comes to the picture. Here, the family physician can be a bridge gap between the oncologist, oncosurgeon, and the gynecologist, and if the urologist is involved, and if any other specialty like psychiatrist is involved. So all these disciplines should come together, and through the family physician or the primary gynecologist, treatment have to be given in such a way that there is sexual rehabilitation of the cancer survivor.
Thank you so much, sir, answering this question, sir. I hope that you have cleared all the doubts related to this topic of participants, sir. As there is no more questions, sir, with all your permission, shall we conclude this session for today?
Yes, yes, yes. Thank you so much. Can I see you? Yeah, on the screen. Yeah.
Yes, sir.
Am I visible? Yeah.
Yes, sir. You are
So
clearly
I
visible, sir, from the
sincerely
starting.
for us. Thank you very much for anchoring today's session. It was
Yes,
excellent,
sir.
and the questions were also very, very thought provoking and gives an
Yes, sir.
insight about the subject so that we understand it better. And I'm extremely happy that IJCP is taking so much pain and effort to deliver the goods to the nook and corner of our country, to the remote practitioners of medicine and surgery. And I hope they get benefit out of my lecture. I'll be very happy to look forward for more topics like this, so that
Yes, sir.
we will
Sure, sir.
convey, yeah, especially the what better treatment options can be given for our clients, especially in the field of sexual medicine and infertility. Thank you so much. Shubharatri.
Welcome, sir. And sir, we would like to see you in future also with different topics, sir. It was great honor
Thank you.
to host you, sir.
Thank you.
And
It
thank you
will
so
be
much.
my pleasure to be with you.
Yes, sir.
In
And
fact, I
thank you,
learn
sir.
more by participating with you.
Yes, sir. And thank you for always available for the healthcare knowledge, sir, and sharing to all the different parts across the country, sir. Great honor once
Thank
again.
you.
We are closing for
Thank
today, sir, with all your permission.
you. Okay.
Take care,
Thank
sir.
you. Good night, Shubharatri.
Good night, sir.